You want to remove the stuck energy from the area of abdomen. Then we know here we are having rib, here we are having diaphragm. This is the navel area. And here we are having liver 13 number point. So liver 13 number point, what is the location of liver 13 point? And just next to liver 13, we have gallbladder 25 points. I will tell you the location. 2 points are just located here. Liver 13 and the gallbladder 25. 2 point यहाँ पर पाए जाते हैं. So liver 13 point found on the tip of 11th rib. On the tip of 11th rib. And gallbladder 34 point found on the tip of 12th rib. ये दोनों बिंदु tip of the 11th or the tip of the 12th rib पर पाए जाते हैं. So these two ribs are very special ribs because 11th and 12th ribs are floating ribs. Floating ribs means they are just floating in the air, in the sky. ये दोनों पसलियां हवा में फ्लोट करती हैं और इन्हीं का टिप बड़ा महत्वपूर्ण है. And we can search it very easily. I will tell you that how to search it. हम बताएंगे कि आपको कैसे सर्च करना है. So in that way, when we talk about the liver 13 point and when we talk about the gallbladder 25 points, these 2 points are very important point. I will tell you the importance of these points. Before that, let's go and see the ribs. एक बार पसलियां दिखा देते हैं हम. So हमारे शरीर में कुल कितनी रिब्स पाई जाती हैं बताइए. How many ribs we have total? So total how many ribs we have in the body? So we have 12 pair ribs. 12 in the right side, 12 in the left side. So we can see 1, 2, 3, 4, 5, 6, 7, then 8, 9, 10. Okay, 10, it's okay. But when we talk about the 11th and 12th. So see 11th and 12th are floating ribs. ये दोनों floating है और बड़ी महत्वपूर्ण है क्योंकि इनके टिप का पॉइंट ही गजब का है. The point found on the tip of 11th is liver 13 and the point found on the tip of 12, that is gallbladder 25. इसके टिप पर जो बिंदु पाया जाता है इसे हम कहते हैं लिवर 13 और इसके टिप पर जो बिंदु पाया जाता है इसे हम कहते हैं गॉलब्लैडर 25. Liver 13 is very important point. Why? Because it's working on all the female problems like the PMS, premenstrual symptoms, ovarian cyst, emotional fluctuations, and the liver chi stagnations. लिवर 13 एक बहुत ही स्पेशल बिंदु होता है जो अधिकतर प्रॉब्लम्स पर काम करता है और जब इस बिंदु को हम मसाज करते हैं, इस बिंदु को जब हम ट्रीटमेंट देते हैं, so it's bring very good effects, right? Now regarding the gallbladder 35, gallbladder 25. The gallbladder 25 is the special point of kidney, जिसे हम किडनी का अलार्म पॉइंट भी कहते हैं. So gallbladder 25 is the alarm point of kidney. ये हमारे किडनी का अलार्म पॉइंट है. Because it's the alarm point of kidney, that's why it's working on the wound, it's working on the slip disc, and also it's working for the infertility, and it's working for the all gynecological problems. क्योंकि किडनी का संबंध तो है ही, हम जानते हैं किडनी ही रॉ मटेरियल प्रोवाइड करती है. And liver is connected, we know that liver 13 is the alarm point of liver. and it's connected with the liver chi stagnation. ये हमारे liver chi stagnation से संबंधित है. And also it's connected with all the emotional suppressions. During the PMS, प्रीमेंस्ट्रुअल सिम्टम के समय जो भी लक्षण पैदा होते हैं, इन सभी को ठीक करने वाला है liver 13. Now I would like to bring a focus on one more point, that is liver 14. Sorry, liver 13 is not the alarm point of liver. Sorry, liver 13 is the alarm point of spleen. Okay. Liver 13 is the alarm point of spleen, and liver 13 is the alarm point of spleen, but even it's working for all the yin organ. ये सारे yin organ पर काम करता है, क्योंकि ये yin organ को influence करने वाला बिंदु है. It's the influential point of yin organ. Liver 13. Liver 13 is very special point. Now liver 14 is the alarm point of liver. ये हमारे liver का alarm point है, liver 14. So right now my focus will be 3 points: liver 13, liver 14, gallbladder 25. Liver 14 is the alarm point of liver, and it's a really very special point. ये बड़ा ही गजब का बिंदु है, liver 14. Liver 14 will become very much painful in all the gynecological problem. जितनी भी gynecological problems होती हैं, उन सभी में liver 14 काफी दर्द वाला बिंदु हो जाता है. It's a very highly painful in all the gynecological problem. We know that nipple is located in the 4th intercostal space. Nipple की जो स्थिति है वो 4थी intercostal space है. अगर उससे हम थोड़ा सा नीचे चले जाएं, करीब 2 चुन नीचे, in the 6th intercostal space, we are finding the liver 14. Liver 14 को जानने का दूसरा तरीका, liver 14 and CV14 are near about at the same location. Liver 14 और CV14 लगभग एक लोकेशन में पाए जाते हैं. Sometimes you might feel difficulty or how to locate the liver 14. तो liver CV14 को निकालना आसान है. CV14 की अगर horizontal line पर आप चले जाते हैं, nipples की line में आपको liver 14 मिलता है. So from the horizontal line of CV14, if you are moving, then you are getting the liver 14. So let's see here. So this is the location of liver 14. Liver 14 is near about at the horizontal level of the CV14, और हम जानते हैं कि CV14 नाभि से 6 चुन ऊपर होता है. So now special attention will go to the liver 13, which is affecting the liver. Liver 14, which is the alarm point of liver. ये दो बिंदु पर हमारा मुख्य फोकस होगा. And other than that, I told you, अगर आप liver 13 की लोकेशन को देखना चाहें, if you want to see the location of liver 13, so it will be nearby CV10. हमारे CV10 की horizontal line पर होता है, लगभग 6 चुन दूर. If you from the CV10, so we can measure with the help of CV meridian. For example, if from the CV10 I am going horizontal, I will reach on the liver 13. If from the CV14 I am going horizontal at the 4 chun, I will get liver 14. तो एक 4 चुन की दूरी पर, एक 6 चुन की दूरी पर मिलता है. CV10 और CV14 पर दोनों बिंदु लिवर स्टैग्नेशन के लिए बेहतरीन पॉइंट्स हैं. Then I told you gallbladder 25. If we see the location of gallbladder 25, so let's see this. This is the gallbladder 25. So gallbladder 25 and liver 13 are near about at the same level. इन दोनों बिंदुओं के बीच में लगभग 2 चुन की दूरी होती है, लगभग एक ही लाइन में है, liver 13 and gallbladder 25. So we can see on the back side we have the backsu point of kidney. In the middle we have the backsu point of spleen. Sorry, front view point. So in the side we are having front view point of the kidney, और उसी के ठीक आगे हमारा है front view point of the spleen. So we can see 2 front view point here, liver and spleen, right? Fine. So gallbladder meridian is very important meridian because it's passing through the breast, supplying the tissue of the breast, and it's also passing from the brain. so connected with the secretion of the brain and the secretion of the pituitary gland. तो गॉलब्लैडर मेरिडियन का बड़ा गहरा संबंध है, इसीलिए आप देखेंगे कि यहाँ पर माइग्रेन होना इट्स ए वेरी कॉमन ड्यूरिंग द इमोशनल फ्लक्चुएशन, ड्यूरिंग द लिवर ची स्टैग्नेशन. गॉलब्लैडर मेरिडियन का प्रभावित होना, यहाँ पर सिर दर्द होना बड़ा ही आम है. और इसी मेरिडियन में हमारा किडनी 25 नाम का बिंदु आता है. दैट्स अ वेरी गुड पॉइंट फॉर द किडनी. पॉइंट गॉलब्लैडर पर है, लेकिन वो अलार्म पॉइंट है किसका? अलार्म पॉइंट है वो किडनी का. Now I would like to bring a focus. So not only gallbladder 25, this whole gallbladder meridian is alarming about the kidney. ये पूरा का पूरा रूट किडनी को अलार्म करता है. If you massage in this area, it's alarming the kidney. तो अगर आप जान जाएं कि कहां पर gallbladder 28 होता है, so this is the 25, then the 26, then the 27, then the 28. अगर आप जान जाएं कि कहां पर 28 होता है, ये पूरी लाइन किडनी को कनेक्ट करती है. दिस होल लाइन इज कनेक्ट विद द किडनी. द पेन इन दिस एरिया एनीवेयर इज डूइंग द रिप्रेजेंटेशन ऑफ किडनी. इस रास्ते में होने वाला कहीं का भी दर्द बताता है कि किडनी में तकलीफ है. तो चलिए एक बार यहां दिखाता हूं. 25, 26, 27, 28, these 4 points play a very important role. So now if you look at in this image, अगर आप इस इमेज को देख पाएंगे तो you can see this. This is the hip bone. And the anterior side of the hip bone, this is the location of gallbladder 27, 28. हमारी hip bone का जो front side है वहीं पर ये बिंदु पाया जाता है. Now we'll see the practical demonstration, then you will able to understand properly. Okay. So before doing the practical demonstration, I would like to bring your focus here that the CB meridian found in the central line, which is very important meridian for the gynecology. CB meridian जो central line में होता है वो gynecology के लिए बड़ा ही महत्वपूर्ण role play करता है. Then the kidney meridian located just next to that is also playing a very important role for gynecology. The stomach meridian just next, that is also playing the important role for gynecology. So all the meridian found here playing the important role of the gynecology, right? So when we want to treat anything, we have to focus in this front area as well as we have to focus in this back area. In this back area, we can do guasha and cupping. हम back area में guasha cupping कर सकते हैं. और front area में acupressure, moxa, as per requirement, we can do something. Okay, let's see now. So let's proceed ahead. So many person even want to reduce their abdominal fat. So the very good technique for that purpose as well. So look at here first. So now we can see. So this is the last part of the we can see here. This is the lower border of the ribs. This lower border of the ribs play a very important role for all gynecological problems. Even as per the Marma Sanskar, these points located at the lower border of the ribs are very good for male and female genital problems. Like in the Marma Sanskar, this Marma Bindu is called Pal Marma, and the Pal Marma is very important Marma point for all the reproductive problems. So this Pal Marma located near about 2 fingers away from the center. So from the 2 finger away from the center, if we are doing the acupressure on the lower border of this ribs, it's playing a very important role. So what we can do, we are having multiple objects to stimulate the point on the abdomen, like we are doing guasha, we are doing cupping, we are doing moxa, we are doing cupping, we are doing this guasha. As per the need, we will take the instrument and we will activate the energy. तो जरूरत के अनुसार हम जहां जिसकी जरूरत होती है हम लेते हैं, लेकिन हमारा जो पहला टारगेट होता है, पहला लक्ष्य होता है, the first symptom will be stimulating the lower border of the ribs, because the ribs is playing a very important role in this products. So now from the navel if we are going one chun, so navel is the CV8 point. Navel का जो नंबर होता है वो होता है CV8. अगर नाभि से एक चुन ऊपर जाते हैं, that is CV9, one chun, अब CV10, CV11, CV12, CV13, 14, 15, 16. So all the points are one chun up from the navel. नाभि से एक चुन हम ऊपर जाते हैं तो हमें सारे बिंदु मिलते हैं. So from the navel, if I am going 2 chun up, so that is the location of CV10. अगर नाभि से मैं 2 चुन ऊपर चला जाता हूँ तो CV10 की लोकेशन है. Now from the CV10, if I go horizontal, I will get the liver 30. अगर मैं CV10 से हॉरिजॉन्टल जाऊंगा तो मुझे लिवर 13 मिलेगा और CV10 से लगभग 6 चुन की दूरी पर होगा. इट विल बी नियर अबाउट 6 चुन अप अवे फ्रॉम द CV10. सो आई कैन मेजर इन दिस वे. दिस आर 3 चुन एंड दिस आर 3 चुन. सो आई हैव रीच्ड हियर. नाउ आई विल बी सर्चिंग द रिब्स. अब मुझे यहाँ पर रिब को सर्च करना होगा. तो हो सकता है थोड़ा आगे पीछे हो. सो आई हैव टू सर्च द बॉर्डर ऑफ द रिब्स. सो लेट मी सर्च. Oh, exactly. I am just on the border of rib. Wonderful. So this is exactly the liver 13 point. ये हमारा liver 13. This is very important point for we know in the liver chi stagnation we always stimulate this point. हम इसको हमेशा stimulate करते हैं. So we can put the few drops of oil here and we can stimulate the point with the help of Guasa. It's a wonderful activation. We can do the Guasa here for 1 minute. You can see I've done just for 20 seconds. This area became red. Lal ho gaya. So when I am doing the Guasa here for 1 minute, definitely there will be too much redness, but it's a wonderful effect. So in the same way, doing the same, never forget liver 13. Whenever you want to keep any types of the gynecological problems, आप liver 13 को कभी मत भूलिएगा. There are 2 reasons for that purpose. The reason number 1, the liver 13 is the alarm point of the spleen. ये spleen का alarm point है. हम जानते हैं कि spleen blood बनाने में मदद करती है. Spleen is responsible for formation of the blood as well as spleen is also connected with the hormones. Spleen का संबंध हार्मोन से भी है. Number 2, the liver 13 is the influential point of all the yin organ. सारे के सारे yin organ का influential point है. तो चाहे फिर किडनी की बात हो, स्प्लीन, लिवर की बात हो, हार्ट की बात हो, लंग्स की बात हो, सभी को जब एक्टिवेट करता है तो वी कैन नेवर ignore this part. This is the wonderful. In the same way, from the CV10, if I am going 6 chun on the other side, so this is a 3 chun and this is a 3 chun. Now I will searching the upper border of the ribs. Wow, directly I am just on the tip of the rib. But as per the size of abdomen, किसी का पेट मोटा होता है, किसी का पतला होता है. So you have to sometime you need to search because if someone is having very big belly, then he have to. So then from the nipple line, you have to go 2 chun away. So nipple line से आपको 2 chun दूर जाना होगा. Again, I am doing the Guasa here for minimum 1 minute. So the question comes, can we do Guasa more? Yes, we can also do the Guasa more than 1 minute as per the capability of the patient. So the liver 13 will be very important point for this purpose. So after doing the Guasa, my liver 13 is over. Now, next, I have to set the point that is gallbladder 25. I told you gallbladder 25 is the alarm point of kidney. Gallbladder 25 alarm point kidney का होता है और इसी liver 13 से 2 चुन और पीछे जाना है. अगर मैं यहीं से 2 चुन और पीछे चला जाऊंगा तो मुझे किडनी 25, तो मुझे gallbladder 25 मिल जाएगा जो हमारी किडनी का अलार्म पॉइंट है. So the gallbladder 25 is the alarm point of kidney, and this point is very wonderful for kidney and the bone and the slip disc problem, lower back, ये कमर दर्द आदि के लिए बड़ा गजब का बिंदु है. तो जब कोई व्यक्ति कमर दर्द का शिकार होता है, हम liver 13 से लेके gallbladder 25 को अच्छी तरह से ट्रीटमेंट देते हैं. We can also do little cupping here to activate this area. Okay, and we can do the Guasa here. So let's search first. So I am coming to the CV10. मैं CV10 पर आ रहा हूँ. Now, if I am going 6 chun, then I am reaching to the liver 13. Again, I am going 2 chun more, then I will be reaching on the gallbladder 25. अब मुझे क्या करना होगा? मुझे rib का tip सर्च करना है. Whether I am on the right position or not. So I have to cross verify. मुझे cross verify करना होगा कि मैं सही स्थिति में हूँ या नहीं. तो मुझे सर्च करना होगा कि गॉलब्लैडर 25 कहाँ है, इसका टिप कहाँ है. So I am searching the, wow, I am directly on the, okay, maybe I will check again. This is a 6 should, there is the liver, okay, 3 should more. So I am again feeling the tip of the bone here. So here I have felt the liver 13, and now here I am again feeling the tip of the 12th rib. The distance between both near और two chun, ये हमारा गॉलब्लैडर 25 है. जब भी कभी किसी को स्लिप डिस्क हो, कमर में दर्द हो, आप करिएगा, आप सिर्फ इस पॉइंट को भी एक्टिवेट करिएगा. मर्मा शास्त्र में कहते हैं इस पॉइंट को आप ऐसे दबाओ, ऐसे, तो स्लिप कमर का दर्द ठीक हो जाता है. So I am stimulating this point. I will be stimulating with the help of Guasa because it's very easy to do and it's improving this point very nicely. Needle हो सकता है कि आपकी लोकेशन गलत हो जाए, लेकिन जब आप Guasa करते हैं तो आप ज्यादा एरिया कवर करते हैं. तो लिवर 13 से लेकर गॉलब्लैडर 25 तक का एरिया जब आप कवर करते हैं, so there is assurity that you are doing right. You are doing perfectly right. There is a wonderful treatment. If you do it, patient will be getting the benefit on the single sitting. एक ही सिटिंग में पेशेंट बोलेगा feeling much better. So I have done the Guasa here. In the same way, I will be doing the Guasa on the other side. Every time I am applying the coconut oil here, हर बार मैं coconut oil लगा रहा हूँ. So liver 13 से लेकर अगर मैं 2 चुन पीछे तक का एरिया एक्टिवेट कर देता हूँ, तो ऑलरेडी मेरे दोनों पॉइंट एक्टिवेट हो चुके हैं. I have worked very nicely. Now this meridian, the gallbladder meridian from here going here, we can see, we can feel this the bone. ये हमारी हिप बोन का हिप बोन है. ये हमारी हिप बोन की आगे की हड्डी है जिसे हम इलियम बोन कहते हैं. हिप बोन 3 हड्डियों से मिलकर बनी है. इलियम आगे है, इस्चियम थोड़ा नीचे की ओर है और पीविस जो बीच में. ये जो हड्डी है ये इलियम है. दिस इज द इलियम बोन. So in the hip bone we are having 3 total bones. This is the ilium bone. So we have to do the massage on this border. This massage is very deeply connected with the reproductive part and the kidney. तो जब हम किडनी, हम यहाँ किडनी के बिंदु से और यहाँ पर हम एक उंगली किडनी के पॉइंट पर रखते हैं. So from the C to 10 we are going 3 chun, 3 chun and 2 more chun. We have reached on the alarm point of kidney. और एक हम अपनी अंगूठा रखते हैं ये हिप बोन के ऊपर. ना यहाँ से लेके यहाँ तक हम पूरा एक ट्रीटमेंट देते हैं. ये गोलाई में पूरा ट्रीटमेंट देते हैं और इस पूरे हिप बोन को एक्टिवेट करते हैं. दिस इज अ वंडरफुल ट्रीटमेंट. एंड सी सब व्हेन वी आर प्रेसिंग हियर, तो कई पेशेंट को दर्द मिलेगा और किसी पेशेंट को यहाँ प्रेस करने पर दर्द मिलेगा. अगर किसी पेशेंट को यहाँ पर प्रेस करने से दर्द मिले तो समझ जाइएगा कि उसी साइड की किडनी में तकलीफ है. और किसी पेशेंट को राइट साइड में प्रेस करने पर दर्द मिले, इसी गॉलब्लैडर के पॉइंट्स के ऊपर समझ आइएगा कि राइट साइड की किडनी में प्रॉब्लम है. So the patient is having problem in the right side of the kidney. If the pain in the right side, left side of the kidney, the pain in the left side. Now one more thing. The meaning of kidney is not the kidney organ. हम किडनी की बात कर रहे हैं तो हम किडनी ऑर्गन की बिल्कुल भी बात नहीं कर रहे हैं. When we are talking about the kidney, we are talking about the bones of the same side. So generally, I have seen clinically when I am pressing this point, patient is feeling the pain. जब हम इस बिंदु को प्रेस करते हैं, पेशेंट बोलता है कि दर्द हो रहा है. तो इसका अर्थ है कि उसी साइड का घुटना दर्द होगा, उसी साइड की कमर दर्द होगी, उसी साइड का कंधा दर्द करता होगा, उस साइड कहीं ना कहीं हड्डियों में दर्द होगा. So when we are pressing the point and the patient is telling, oh, this is very painful, other side is not painful. So this side is painful means this is the diagnosis that person is having pain in that side. So now I am taking some oil, putting in this here in this line. So now I will be stimulating this point from here to here. Now you can understand when you are doing the Guasa here, even it will reduce the belly fat. The belly fat को भी remove करेगा. So the wonderful activation of the gallbladder point. We are stimulating the gallbladder point not for the gallbladder. We are stimulating the gallbladder point for the kidney, because kidney is connected with the genital part. Okay, so the main focus will be on this bone. So let's press the bone. Press the border of bone. This will be very much painful if the person is having problem. ये काफी दर्द करेगा अगर व्यक्ति को प्रॉब्लम, ठीक है. We can do it with the hand. So in the same way we will be doing on the other side. We can use with the hand, or we can use the Guasa. Okay. So after that, my next focus, we have focus on the liver 13, then the gallbladder 25, then the line of the gallbladder coming to the iliac bone. हमने liver 13 को एक्टिवेट किया, gallbladder 25 को एक्टिवेट किया और उस लाइन को एक्टिवेट किया जो हिप बोन तक आ रही है, और हमने ये gallbladder 25, 26, 27, 28 ये चार बिंदु होते हैं, इनको एक्टिवेट किया. So just need to focus on the upper border of the hip. We can come till the front side. कहते हैं कि नाभि के 3 अंग जो नीचे तक फोकस करना है. So this is the level, keeping the forefinger, right? At least you have to focus till this area because this is the gallbladder 20. This is the gallbladder point. तो आपको नाभि के 3 जो नीचे तक वाले एरिया को फोकस करना होगा. So from here till the here you have to do the proper treatment, whether you do cupping, Guasa or the acupuncture. So even we can put the needle. I will also demonstrate you that how to put the needle. Now the next focus will be liver 14, which is very much important point. With the help of these points, you will get surprised that whatever the problem connected with the gynecology, you will be able to work on that. So agar on nipple line se, if from the nipple line we are moving downward, so from the nipple line we are moving downward, then we will getting the liver 14. इसमें liver 14 मिलता है, लेकिन मिलेगा कहाँ? So the nipple is located on the 4th intercostal space. Nipple तो 4th intercostal space में है. हम 6th intercostal space बताएंगे लगभग 3 चुन नीचे, तो हमें 2 से 3 चुन नीचे, तो हमें मिलेगा liver 14. लेकिन liver 14 को जानने का दूसरा तरीका है, from the CV 14 if you go horizontally then also होगा liver 14. तो नाभि से हम जब 6 चुन ऊपर आते हैं, तो 1 चुन, that is 9, 10, 11, 12, 13, 14. Or from the navel, if you are coming 6 chun up, then reaching on the 3 chun and the 3 chun. Reaching on the CV14, हम जानते हैं कि CV14 हमारे heart का alarm point है. This is the alarm point of the heart. So from this line, if we are going horizontally, this is the liver 14. And I will tell you this point will be too much painful for the male and female having liver problems because this is the alarm point of the liver. ये point गजब का painful होता है अगर male female को liver की problem है. If the female are suffering with the gynecological problems, the uterine fibroid, PMS, premenstrual symptoms, or any problem, this point will be highly painful. इसको needle लगाना इतना comfortable नहीं है, और तो इसको हम मोक्सा कर सकते हैं और इसको हम acupressure कर सकते हैं. So I will always prefer this point to be the moxa. This point will be too much painful. Many patients will not allow you to touch this point because there was too much pain here. इतना दर्द होता है कि कई पेशेंट आपको ये point touch भी नहीं करने देंगे. So you have to minimize your pressure as per the comfort of the patient. तो आपको pressure को minimize करना होगा. जितने patient, or so we will be doing 1 minute Guasa. You will be surprised the 1 minute Guasa is also enough. So doing same on the other side. So from the same 14, if we are going, always we are putting some lubricant like the oil and doing the Guasa here. So after stimulating the for the 1 minute, now we have stimulated liver 13, gallbladder 25, and the 4 point of the gallbladder meridian, that is 25, 26, 27, 28. Now we will come in the central line. अब हम central line में आते हैं. पहले इतने point use करने के बाद हम central line में आएंगे. Now in the central line we are having few more important points below the navel. नाभि के नीचे दो बिंदु काफी गजब के हैं। The first point located 2 finger down, the second point located again 2 finger down. पहला बिंदु नाभि से 2 उंगल नीचे है, दूसरा बिंदु भी नाभि से 2 अंगुल नीचे है। 2 अंगुल का अर्थ होता है 1.5 चुन। So the first point located 2 finger below from the navel, or the 1.5 चुन below from the navel, that is called CV6, जिसे हम CV6 कहते हैं। CV6 is the vitamin point. It is improving the vitamin in the human body. CV6 is connected with the kidney yang. ये kidney yang से संबंधित है। CV6 is improving the enthusiasm in the human body. ये हमारे शरीर में enthusiasm को बढ़ाता है। So the CV6 is the very important point, right? And CV6 is very good point for the yang. अगर आपकी diagnosis confirm है कि आपको yang बढ़ाने की जरूरत है, तो आप इसका stimulation कर सकते हैं, right? Now, if you go 2 finger down, that is a CV4. तो हम इन दोनों बिंदुओं पर लाल रंग लगाते हैं। जो पेशेंट इनफर्टिलिटी के शिकार होते हैं उन दोनों को हम लाल रंग लगाते हैं। So this point is not only working for the infertility, but these points are very good for improving the enthusiasm. हम इस पर मोक्सा रखकर मोक्सा कर सकते हैं। When we are doing the moxa here, it's wonderful. We can do the moxa for 15 minutes. हम 15 मिनट के लिए यहाँ पर मोक्सा कर सकते हैं। और we can do the moxa just by holding the moxa stick, or we can do the guasa here. हम यहाँ पर guasa करें, ये बहुत ही गजब का काम करता है। So right now my focus is CV6 and CV4. CV6 is the point of yang, CV4 is the point of yin. लेकिन CV4 yin yang दोनों पर भी काम करता है। So we are doing the guasa here. Now after doing the guasa here, we are going half turn, both the side, half turn right side and the half turn left side. This line is called kidney meridian. ये kidney meridian की लाइन है। तो CV6 के बगल में जो किडनी का पॉइंट है वो भी यांग को बढ़ाता है। CV6 यांग को बढ़ाता है, तो उसके बाजू में किडनी का पॉइंट भी यांग को बढ़ाता है। CV4 यिन को बढ़ाता है, तो उसके बाजू वाला पॉइंट भी यिन को बढ़ाता है। तो because CV, the point located on the both sides, they are also doing the same whatever done by this point. So the point located on the both sides may be little up to up or up to down, working the same in the same way like this point is working. तो हम जानते हैं कि नाभि के दोनों ओर ये किडनी 16 नाम का बिंदु होता है, किडनी 16. Now we are going one to down, that is kidney 15. Then we are going one to down, that is kidney 14. Kidney 14 is very good point for improving the yang. It is working like the CV6. तो kidney 14 जो होता है वो हमारे या गजब का है जो CV6 की हेल्प करता है. So we can do the guasa here. हम यहाँ पर guasa कर सकते हैं और we can put the needle here. So we can do the guasa. We can do the guasa here. We have done the guasa in the central line. Now we are doing the guasa. We are stimulating multiple points of the kidney meridian, whether the 16, 15, 14, 13, 12. We are stimulating multiple points because this is the local stimulation of the reproductive area, and it's a wonderful for improving the kidney chi. एक तो हमारे reproductive part का local stimulation है और किडनी की ची को तो improve कर ही रहा है. इसी साइड हम दूसरी तरफ भी किडनी का stimulation करेंगे. Kidney meridian located half to lateral from the central line. So we are doing the guasa here. So in this way we have stimulated CV6, CV4, and the point on the side. यहाँ पर जो बिंदु है इसे हम क्या कहते हैं? हम इसे क्या कहते हैं? Kidney 14. Kidney 14 is very good point for yang, and kidney 13 is very good point for yin. तो नीचे वाले के लेवल पर किडनी 13 है, ऊपर वाले के लेवल पर किडनी 14 है, because kidney meridian is going like this: kidney 11, 12, 13, 14, 15, 16. At the level of navel we are having 16 number पर. इतने पॉइंट का स्टिमुलेशन करना आज हमारा प्राइमरी लक्ष्य था, आज हमारा पहला लक्ष्य था. तो जब हम इन पॉइंट को स्टिमुलेट करते हैं, we also can do the guasa here. I told you we can do the guasa here from here. It's a great stimulation if we do the guasa, right? Fine. So now from here, from the central line, if we go 2 chun lateral, अगर हम 2 chun lateral जाते हैं तो ये stomach meridian मिलता है. Even the stomach meridian is very effective for this whole part. तो CV6 जो काम करेगा, kidney 14 वही काम करेगा और stomach के पॉइंट भी वही काम करेंगे. इसी तरह से CV4 जो काम करेगा, किडनी के पॉइंट भी वही काम करेंगे, stomach के पॉइंट भी वही काम करेंगे. तो we also go two to lateral from here, and we are doing the stimulation of the stomach point, stomach 25, stomach 26, 27, 28, 20, in that way. So we are doing the guasha, two to lateral from here. This is also the great stimulation what we do on the stomach meridian. यहाँ भी हम stomach meridian को activate करते हैं. We can do the activation of stomach meridian even on the other side. So this is a common treatment for all the gynecological problems. Only 1 minute. Let it run out now. Okay. So right now I will show you the how to do the needling here. So right now I'm having only this small needle with me. We can put a smaller, bigger needle. There is no pain in the abdomen. तो देखिए हमने पहले क्या किया? We are stimulating the point. First point we are putting CB4. You can see this the needle. Can you see the needle? Maybe I will. Okay, let me give 1 minute. I'm searching some other needle. Okay, so let me demonstrate with the same needle. So you can use bigger needle. I'm doing that. So the first CB6, then 2 chill down, that is CB4. Even we are putting 1 needle on the CB. हम CB3, 4, 5 तीनों पर needle को लगा देते हैं. You can see. Now on the same line, if we put the point on the kidney meridian. So from the navel, if we go 1 tune down, that is kidney 15, 1 tune down, that is kidney 14. So kidney 14 is this on the both side. Then kidney 13 will be here on the both side. You can see the tune measurement. So we have point estimate. These are the very important points. Now we are coming to the stomach meridian. हम सेंट्रल लाइन से अगर 2 चुन लेटरल लाते हैं तो पहला पॉइंट सीवी 14 के लेवल पर, दूसरा पॉइंट सीवी 6 के लेवल पर हम लगाते हैं. सॉरी, सीवी 4 और 6 के लेवल पर हम एक पॉइंट लगाते हैं. सो दिस इज अ ग्रेट स्टिमुलेशन फॉर रिप्रोडक्टिव पार्ट्स. डन. ओके, फाइन. So now I will be demonstrating you that putting the point on the liver 13. So from the CV, this is the CV. We are going 6 to lateral. This is the location of CV. I can feel the tip of the ribs. My ribs tip. Feel कर सकता हूँ. So this is the point. That is the point. Liver 13. Again I am going 2 to lateral. अब मैं 2 to lateral जाऊँगा. Again I am feeling the tip of the bone. Now I am putting the point here. That is kidney. Alarm point is gallbladder 25. Same I am doing the stimulation on the other side. यही stimulation दूसरी side भी करेंगे. So liver 14 is very sensitive point. Okay, so mostly if we want to add the liver 14, stimulate the point the sujog. इसमें sujog में stimulate करें तो बेहतर है. ऐसे हम गुआसा करें. So this is the treatment. Very good treatment. Now this is the gallbladder point, and I told you this is the gallbladder line. Still here. So हमें यहाँ कहाँ तक पॉइंट लगाने हैं? हमें नाभि के लगभग 3 नीचे तक के लेवल पर पॉइंट लगाना है. So I am feeding the bone here and I am putting one point on the border of bone here. मैंने एक पॉइंट यहाँ border of bone पर लगा दिया. Now I am stimulating a few points in this line randomly. From here to here, I am making a curve and I will stimulate like I am doing the treatment on the both sides. Done. Treatment is complete. Even I will be doing on the other side. इसे हम कहते हैं the treatment to improve all the gynecological problems. Suppose you want to do the treatment with the guasa only, don't want to put the needle, you can do that. आप अकेले guasa से treatment करना चाहते हैं, आप कर सकते हैं. Even the moxibustion is very good treatment. That is the added advantage. Right? With the help of moxibustion, we can create always added advantage. Right? So now I'm removing the needle. So we have to keep the needle minimum for 30 to 40 minutes. So let's remove all. Done. Wonderful. So this was the excellent treatment we have done for the all the genital problem or the reproductive problem. So this is over now. ठीक है श्वेत. So dear friends, enough for today. So this treatment also has been told the treatment of EOV. In the extraordinary vessels, we have one vessel that is called Diamy. Diamy. Diamy means who is circling horizontally. एक्स्ट्राऑर्डिनरी वेसल्स में एक हमारी वेसल होती है जिसे हम डायमाई कहते हैं, जो हॉरिजॉन्टल सर्कल करती है, मतलब हमारी जिसे हम बेल्ट मेरिडियन भी कहते हैं, दैट इज आल्सो कॉल्ड बेल्ट मेरिडियन. सो दिस वाज द वेरी गुड ट्रीटमेंट टू इंप्रूव द बेल्ट मेरिडियन. ओके, सो दिस ट्रीटमेंट इज आल्सो कॉल्ड डायमाई ट्रीटमेंट, DAIMAI treatment. This treatment is very good for all the females. Whether the female having some problem or not can take this treatment intermittently. This treatment is very good for the liver chi stagnation. और इस ट्रीटमेंट की मदद से आप मन को शांत और प्रशांत कर सकते हैं, दिल में मन में शांति लेके आ सकते हैं, क्योंकि जो अशांति होती है वो लिवर chi stagnation के रूप में हमारे शरीर में जम जाती है. When the female is getting liver chi stagnation, they are suffering with the premenstrual pain, they are suffering with the thyroid, they are suffering with many diseases like the nodules, cyst, uterine fibroid and all. So with the help of this, we can remove all the things. So this treatment is mandatory whenever you want to do any types of the gynecological treatment, whether you want to do the treatment of cyst or the PMS or the fibroid or the endometriosis or phase 1, phase 2, phase 3, phase 4, any treatment. This treatment is basic treatment for all. This treatment is called Diamy treatment, right? So when the patient is coming to you, suppose you are giving 3 treatment in a week, 1 treatment you can plan in this way, 2 treatment you can give in a different way. Okay, so we will be discussing in the next class more about this. अभी और भी कुछ बाकी है तो हम समझेंगे अगली क्लास में. तो चलिए आज की क्लास को यहाँ पर समाप्त करते हैं, अब हम मिलेंगे अगली क्लास में. थैंक यू सो मच. क्लोजिंग द सेशन. अभी मुझे आज की क्लास समाप्त करनी होगी क्योंकि मेरी गुआशा की क्लास है. मे बी आई विल गिव यू टाइम इन द नेक्स्ट क्लास. थैंक यू सो मच.